Hello, good afternoon. My name is Bobita Kesikarki. Today I am going to present about the case study of Mrs. Helen Georgopoulos, who is 64-year-old lady. She is allergic to penicillin. She has been admitted to the emergency department due to chest pain relating to jaw. She has a history of hypertension and hyperlipidemia and type 2 diabetes mellitus. Currently, she is diagnosed with acute anterior ischemic sinus tachycardia and diaphoretic. So now I am going to answer the four questions related to case study. Explain the clinical manifestation that led to a diagnosis of acute anterior ischemia. Mrs. Helen has admitted to the emergency department due to chest pain relating to jaw. She has type 2 diabetes mellitus. She has history of hypertension and hyperlipidemia. A myocardial infarction occurs when there is not enough oxygen supply in the coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombus. Insufficient blood flow to the heart muscle occurs chest pain. The pain is caused by lactic acid, which is a product of anaerobic metabolism. If there is not enough oxygen to the myocardium, then it initiates anaerobic metabolism. It affects the contraction of heart. Abnormal contraction of heart leads to the pain. Radiatic pain is caused by afferent somatic fibers that synapse in the same dorsal root ganglia as the thoracic viscera of the heart, lungs, and esophagus. ST elevation is presented by anterior wall ischemia or infarction which leads from V1 to V6. Helen has ST elevation seen in V2, V3, V4 after recording 12 lead ECG. The ST elevation is caused by the inability of the affected myocytes to conduct electrical impulses as the normal repolarization of the cells does not occur in the affected area of the myocardium. ST segment depolarizes all the muscle after the depolarization of the ventricle. In Helen's case, troponin level has been elevated as her pathology results. The myocytes contain the troponin. In the event of elevated troponin, it is known as cardiac biomarker, which is the indication of acute myocardial infarction. Serum testing is important because troponin is found in high concentration, which damaging the larger area of cardio. Number two, provide a rationale for the nursing interventions to care for Mrs. Georgopoulos in the emergency department. The rationale behind supplemental oxygen in the acute setting has been to increase oxygen delivery to the ischemic heart and it limits infarct size. Higher than normal blood oxygen levels can cause coronary vasoconstriction and increased production of reactive oxygen species. In Helen's case, they attach to a lead ECG. The basic principle of the ECG is that changes in the electrical potential of the muscle fibers are caused by stimulation of the muscle. Helen is admitted due to the chest pain relating to jaw. Blood pressure might be dropped when someone has a heart attack because the heart is too weak to sustain it. The muscle may have been damaged in this condition. The pain associated with heart attack can cause an automatic response which can lead to decreased blood pressure and fainting. Systolic blood pressure is changed with patient's respiration monitoring. Blood pressure prevents from other incidents during the time of treatment. A minimum of 2 ECG is required. The initial ECG is performed to identify ischemia in 10 minutes. An ECG should also be performed at repeated troponin and every 30 minutes if symptoms persist. Cardiac monitoring is attached on the arrival in emergency department to assess the patient's heart condition continuously. It shows oxygen saturation and respiratory rates. It is used to identify cardiac rhythm and to determine exact course of treatment. It helps to diagnose acute coronary syndrome. In Helen's case, she has been admitted in ED due to chest pain. In Helen's troponin level has monitored due to her chest pain to detect STMI. The elevated troponin result does not indicate acute myocardial infarction and it identifies that the patient does not indicate low risk. A repeat troponin is recommended if a patient has had symptoms within the previous weeks, as Helen's also has symptoms of this. Single troponin will be sufficient for low-risk patients when there is a cessation of symptoms in more than 6 hours. A positive delta troponin and is associated with ischemic causes of chest pain and high risk. Delta can be found in repetition of protein after 2 hours. Troponin level is to be checked in every 2 hours in rise and fall. Number 3. Discuss the role and importance of cardiac reperfusion. Cardiac reperfusion is a treatment to restore the blood which is done through primary percutaneous coronary intervention and fibrinolytic therapy. The aim of reperfusion therapy is the timely restoration of coronary flow and myocardial perfusion. which limits the extent of MI and reduces mortality by minimizing the total ischemic time. Clots are dissolved in fibrinolytic drugs by converting plasminogen into plasmin, a proteolytic enzyme that digests the fibrin mass or which holds clots together. Tenecteplase is one of the drugs of fibrinolytic drugs. If there is delayed for PCI, they may ready for tenecteplase 45 mg IV. This is usually given in pre-hospital setting and to make easy for administration, especially when there is more bleeding and in Helen's case also there is happened. Tenecteplase should be considered to reduce the risk of intracranial hemorrhage. For reperfusion, PCI can be chosen according to Helen's case study. Coronary angioplasty or primary percutaneous coronary intervention is a procedure used for treating narrowed coronary arteries of the heart and angina in patients. It can be therefore be used in emergency situations for patients who have suffered a heart attack. During primary percutaneous coronary intervention, the coronary arteries are unblocked. A small balloon is inserted through an artery in the groin or arm by using a catheter which is hollow tube. By inflating the balloon, the fatty tissue in the narrow artery is pushed out of the way, improving blood flow to the heart. The catheter contains a stent, which is a small stainless steel mesh tube that expands when the balloon is inflated and enlarges the narrowed blood vessel. Once the balloon has been deflated, the stent is left in the place. The main objective is to implement PCI is less than 90 minutes on the arrival of patient. In Helen's case also, she has been arrived in ED after 30 minutes and they transferred to her in lab in less than 90 minutes to give PCI. So which one is preferred? The standard reperfusion strategy for the treatment is primary percutaneous coronary intervention with stenting during the elevation of myocardial infarction. Question number 4. Discuss the associated nursing intervention considerations related to the medications given to Mrs. Georgopoulos. Aspirin. Aspirin inhibits platelets. It is for prophylaxis of MI, angina, and ischemic stroke. Side effects of aspirin are nausea, vomiting, stomach pain, heartburn, renal impairment, increased GI effects, and bleeding. Nursing consideration of aspirin are: it is usually administered by for oral. Aspirin should not be given with strong vinegar-like odor. Aspirin should not be crossed or to ensure patient does not chew sustained release product. Patient must have dizziness, drowsiness, and so check patient regularly. Heparin. It is an anticoagulant drug. Heparin is for bleeding precautions. Some side effects are hemorrhage, thrombosis, anaphylactic reactions. Nursing consideration of heparin are: the effects of anticoagulants can be seen immediately. Partial thromboplastin time should be checked after administration. Nurses should be monitored the bleeding after administration. And the another one is morphine. The morphine is given for pain management and it belongs to narcotic analgesics. Side effects of morphine are respiratory depression, pain suppression, histamine release, and nausea. And the nursing considerations of this are: do not chew, cut, or cross controlled release, monitor blood pressure before administration, monitor patient's respiratory rate prior to administration, monitor the respiratory depression. The next one is nitroglycerin. It is for dilating the blood vessel and increasing perfusion to the myocardium and decreasing myocardial overload. Side effects are flushing to the face, dizziness, reflex tachycardia, throbbing headache, blurred vision, and hypotension. Nursing considerations are: 0.5 mg sublingual if systolic blood pressure is greater than 110 may repeat twice at 5 minutes intervals for a total of 3 doses. Provide continuous cardiac and blood pressure monitoring. Monitor the vital signs. And the last one is clopidogrel. Clopidogrel is used to evaluate therapeutic response, side effects, nausea, diarrhea, constipation, and GI upset. Nursing interventions are: nurses should be monitored bleeding, monitor pulmonary symptoms, monitor bleeding times, may increase the risk of bleeding. And thank you for listening to me. This concluded my presentation.